Thank you so much, Rick, or Dr. Steketee, for that informative presentation. So now I'd like to call to stage Olivia Ngou and Patrick Sieyes, and then we're actually going to show, to reiterate this message of eradication is possible, it's on the horizon. We're going to show a message from the WHO Director General, Dr. Tedros, who's a former Minister of Health from Ethiopia, to see WHO's message in solidarity that eradication is our goal.
Timenda, mintumenda metekata so saa ti adechia na miniska na makovo besia na medem kana mede no hospital. Nti aya saa krampo no sika medidi medwane na sai.
Eradicating malaria has been a major public health goal for over a century. Many countries have managed to eliminate malaria. Algeria and Argentina are the latest. So, can we now finally eradicate this dreadful disease once and for all? In 2016, WHO called together a group of 13 scientists and international public health experts to discuss that question. After 3 years of study, the WHO Strategic Advisory Group on Malaria Eradication has published its report. Its conclusion is that, yes, we can eradicate malaria, but we must do 3 things. First, world leaders must make a greater political and financial commitment to universal health coverage. Second, we must be more strategic. Last year, WHO and the RBM Partnership to End Malaria launched High Burden to High Impact, a new approach to prevent infections and save lives in the countries with the highest burden of malaria by using the most effective tools in a more targeted way. Third, we must ramp up investment in the research and development of new tools and innovations. And we must do all this fast. Malaria is one of the world's oldest diseases, but if we get this right, we can make malaria history.
Wonderful. So, and that's why we're all here today, yesterday, and tomorrow to take this message to Capitol Hill that we are committed to being the generation to end malaria for good. So it's wonderful to see that so many partners are united against that message. And I just want to start this discussion saying how exciting it is that we're even talking about eradication. Actually, when I joined the malaria-specific world 8 or so years ago, eradication was a very controversial topic. And let me just say, a lot has evolved over the last 5 to 10 years in terms of people coming together to say, yes, this is in fact our goal. We can achieve a malaria-free world. We've made amazing progress, as all of you know. Cases have been reduced by 40%, deaths by 60%, 7 million lives have been saved. More countries than ever are closer to elimination. Yet we know that if we are to achieve the goals that have been set by the WHO and others, we have some work to do in this next decade to make sure that we're on track to hitting our elimination milestones and our overall goal of eradication. So I'm really excited to have this conversation because we're going to get a little bit more granular about what it will take to hit those milestones and achieve those big goals, specifically when it comes to overcoming challenges like insecticide and drug resistance, and in terms of working with endemic countries to even further step up their leadership and commitment and resources committed to this fight. So with that, I'd like to introduce our 2 additional panelists, in addition to Dr. Rick Steketee. So we're joined by Patrick Sieyes, who's the head of global growth with Vestergaard. They're headquartered in Lausanne, Switzerland, and he oversees the company's public health vector control sales of new generation Permanet 3.0, the PBO LINs, or long-lasting insecticide-treated nets that we were talking about yesterday, throughout Africa, as well as global advocacy. Patrick has been with Vestergaard for 16 years and has worked in Denmark, Dubai, Switzerland, and most recently Kenya as a regional director and head of Africa Public Health. He managed the company's flagship Permanet WHO pre-qualified LLINs, including the next generation Permanet 3.0 PBO. So really pleased to be joined with Vestergaard. And again, as I mentioned yesterday, really grateful for Vestergaard's support of the summit overall and just being an amazing partner and pushing us on the importance of innovation to overcome challenges like insecticide resistance. So Vestergaard is also, like I mentioned yesterday, not only are they one of the main companies manufacturing bed nets, they also provide water filters and other key tools to address other diseases around the world. So we're lucky to have them in this fight. We're also joined by Olivia and Ngou. So Olivia is the amazing global coordinator for the Civil Society for Malaria Elimination. She has joined us from Cameroon, so I believe she gets the farthest traveled award, so she gets a clap for that. So Olivia, she did an incredible thing in the lead up to the Global Fund Replenishment in terms of engaging civil society in endemic countries. And we really wanted her to join us because I think it's really important for us to know that not only are we doing this work here in the US, but there are people living in malaria endemic countries that are also doing this work, and that's something that she is working to further grow. So not only is she the coordinator for this work, but she was also the founder and executive director of an African NGO called Impact Santé Afrique, which focuses on advocacy and communications plus capacity building of local civil society organizations on health. Prior to that, she worked for Malaria No More for 10 years, where she led Cameroon and different Africa programs, helping to keep malaria high on the political agenda and rally political celebrities, private sector, community leaders around this cause. Prior to joining Malaria No More, she began her experience on malaria at the UN Special Envoy for Malaria. So again, we're really lucky to have her with us. So thanks so much. So I think we're going to start. Patrick, I'd love to ask you a couple questions, just get the conversation going, and maybe you can present, and then Olivia, I'll do the same for you, and then we can go into a moderated Q&A where hopefully all of you will have the chance to ask some questions. So with that, Patrick, so we've heard a little bit about, in some of the sessions we had yesterday, about some of the scientific challenges that are required. So we know that the mosquito is constantly evolving. It's a tricky little bugger. And so due to the constant evolution of the mosquito vector and malaria parasite, we know that innovations needed to respond and proactively develop solutions to the major obstacles in control, such as insecticide resistance and drug resistance. Would love for you to talk about how you describe the current pipeline of innovations for malaria. And also would love to hear your perspective on what more is needed to achieve the 2030 targets and the overall goal of eradication, and what role does the private sector, such as Vestergaard, need to play in supporting such needed innovation. So would love to hear from you, Patrick.
Thank you very much. I am overly thrilled to be here. I'd like to thank the organizers for putting this event together. I was actually here last year, and I was so impressed by you champions and all the work that you do. So it's absolutely fantastic. It's taken, I've crossed 5 international borders to come here, so maybe I'm rivaling Olivia. And I'm glad that they let me through, which is fantastic. So in order to address the questions, I have 3 key subjects that I'd like to talk about. The first one is the importance of the humble bed net. And the second one is that we need to learn to work with the most efficacious tools of today before we even start talking about tomorrow. And not surprisingly, the third one is that we need to prepare for tomorrow's innovations today. So we've all understood a little bit about the long-lasting insecticidal nets, as we know, LLINs, and they've been the standard of prevention since 2000. But this year, the malaria community celebrates a significant and at one time inconceivable milestone, namely the distribution of the 2 billionth bed net. 2 billion bed nets have been distributed. Now, some 800 million of those have been permanent mosquito nets that have been distributed in over 100 countries and have protected a cumulative 1.6 billion lives. So to what Dr. Rick Steketee was talking about earlier, what a success story. And I'd like to think that we know an awful lot about taking bed nets to market. Now, why the 2 billion number is significant is manifested in a series of monumental achievements since 2004. So you see 7 million lives saved, 1 billion cases of malaria averted, and almost 70% of averted cases have been attributed to the humble bed net. And I'd like to take this opportunity to acknowledge the tremendous support and achievement by PMI, without whom we simply wouldn't have achieved these milestones. It is the result of this increased global collaboration to purchase, distribute, and increase the use of effective mosquito nets that has protected millions of families around the world still living at the risk of malaria. But I'd also like to appreciate, again, all your tremendous work and commitment to ensure funding is continuously made available to eliminate malaria. And I really do look forward to hearing your meetings tomorrow. But we have to protect the very fragile gains conferred by the humble bed net. And the latest World Malaria reports tell us so. Our efforts are somewhat flatlining. And in several instances, in several settings, we're a little bit in reverse. Now, insecticide resistance, as you may have heard, is to at least one of the 4 insecticide classes has been detected in 73 countries. And in 26 countries, resistance has been reported to all main insecticide classes. So that toolbox that we have available is limited by the spread of insecticide resistance at present, and we need to do something about that. And although it might seem that we just need to get more LLINs, insecticide-treated nets, out there, there is actually a growing body of countries that are shifting away from the traditional universal coverage over to more effective coverage by embracing newer tools. So countries with high prevalence of malaria and insecticide resistance are rapidly shifting away from monotreated nets or pyrethroid-only long-lasting nets to, indeed, the next generation PBO LLINs, such as our Permanent 3.0 and Sumitomo's Olicet Plus PBO net, and indeed also those with dual insecticides. And this is absolutely tremendous. When I started out 16 years ago, little did I know that here we are so many years later with a number of new tools that are actually being deployed. Now, these include countries such as Kenya, Malawi, Tanzania, Zambia, and some of the largest and most significant high-burden, high-impact countries, as mentioned by Dr. Tedros, including Burkina Faso, DRC, Ghana, Nigeria, and Uganda. And so countries are actually updating their national strategic malaria plans, as well as rewriting their country policies to switch away from pyrethroid long-lasting nets. And I've had the extreme pleasure of living in Africa. I've spent 10 years there over the last 20 years, and it's wonderful to see this groundswell from countries that are beginning to shift away from tools that are less efficacious. But we're keenly aware that this is a critical decision-making moment with success in the balance. We're approaching the last mile in the fight against malaria, and we actually expect it to be the toughest part. Rooting out pockets of malaria in the toughest to reach parts of Africa, the most remote and underserved areas of the world where insecticide resistance is potentially threatening progress. We must dramatically step up our efforts to ensure that only the highest quality, most efficacious tools are distributed efficiently, transparently, and equitably to the areas where they're needed most. For us, it means embracing these next generation nets as the new standard of care while we continue to innovate new tools. The world is counting on us to do so. Now, if we take a cue from the past, we note how in 2004, LLINs were introduced as the next generation tool, replacing ITNs, or the non-treated nets, or the dipped nets. So from 2004 to 2010, as we were targeting the Millennium Development Goals and universal coverage, globally we experienced a formidable scale-up of new LLIN technology. And I specifically remember this moment because Vestergaard scaled up to over 10 million nets produced per month. And in 2020, we should then make the parallel with the renewed effort now required to bring new generation PBO LLINs to a similar scale. And we are reacting very positively to this rapid scale-up of production by more than doubling our production year on year. And as a responsible company, we believe the time has come to switch over our production of pyrethroid-only LLINs now to more effective PBO LLINs. And we're ready to call on the normative environment to withdraw and update the policy on deployment of generic pyrethroid-only LLINs. So like we switched from chloroquine to ACT, we believe the time has come to switch from pyrethroid only to PBO LLINs. So we need to move away from what is least efficacious and learn to work with the most efficacious tools of today to target elimination. So to the question on the private sector pipeline in innovation, well, the good news is that we are more or less ready to make whatever new tool is needed and take it to market. Our R&D, our production, our supply chain, sales, management, etc., it's all primed and ready. We've been doing this for over a quarter century. So whether it's Permanent 4.0, Permanent 5.0, 6.0, it's ready when the road opens up. But herein lies the problem. The road is not as well paved as we would like. And to any of you who have been to or lived in Africa, I'm sure you're cognizant of the potholes. So we see that this road is a little potholed at the moment. And as an industry, we seek a lot greater clarity around how a new innovative product even enters a new class. So one of the issues that we've been facing is that it's taken simply too long to bring innovation to market. You've heard about the Permanent 3.0. Well, in essence, it's taken 15 years to bring that new product to market. And we need to do better. There is need for much greater industry collaboration to achieve the lofty goal of malaria elimination, which we very strongly believe in. We need to bring the private sector and our expertise to the table much, much earlier. We collaborate as best as we can, and when we're invited to the table, we love to suggest ways to optimize the framework of bringing new products to market and allowing the industry to better innovate. It's what private sector is very, very good at. We understand what malaria stakeholders require of us: quality, dependability, affordability, scale, innovation. And the industry, in turn, would appreciate much greater visibility and predictability. This would help us greatly in terms of the research and development costs and, of course, any capital expenditures. So perhaps a volume guarantee might be the right solution. Donors need the supply side and industry needs the demand side. But we have to figure out as an industry to maybe pay more for effective innovation. It will be difficult to bring out innovative bed nets at the same price as generic nets. You see, putting chemistry on a bed net is a lot more difficult and a lot more costly than you would think. Screening active ingredients that are safe to humans but lethal to mosquitoes and mass produce and distribute them safely is simply not easy. We need a more customized approach to vector control. A one-size-fits-all is no longer appropriate. Effective coverage over universal coverage, supported by a lot more granular data, is certainly a way forward. A volume guarantee commitment seems an obvious approach to balance out any additional costs of an effective innovation. We're very comfortable with the future pipeline of innovative products, and our screening provides us with numerous candidate products. And these would include non-pyrethroid, dual active ingredients. However, until we can address these potholes and increase collaboration across all sectors, we still have a way to go before we can actually bring innovation to market faster than the mosquito can mutate. Now, Uganda is a great example of a country that has deployed new generation LLINs with some tremendous success in terms of reducing the burden of disease as well as deaths. We believe this, amongst many other examples, evidence that for the time being, we should learn to work with the most efficacious tools of today whilst we prepare the road to elimination for tomorrow. We are certainly ready. Thank you.
Thanks so much, Patrick. So hopefully, one, for your passion and commitment and providing those additional insights into the challenges and the work ahead in terms of bringing innovations to market. I would now like to, Olivia, we'd love to hear from you about well, and I should just say that, as mentioned yesterday, in our advocacy for PMI has taken a leadership role in this world. They recognize that insecticide resistance is a increasing issue. And so as you all advocated for last year, we were able to help secure that $15 million increase for PMI in fiscal year 2020. That was actually so that they could deploy these next generation or PBO nets. And we will go on Capitol Hill tomorrow with an ask to increase that even further so that PMI can both scale up the deployment of those nets and maybe even make that full transition, but also to increase the care, treatment, and testing of children and pregnant women in 6 countries. So more on that later, but just so you know that we're on top of it, and there's been a lot of evolution just in the last 6 months and year on this topic. So you all have been on the forefront of that and have made it possible. So Olivia, I would love to turn to you and would love for you to speak about the role of individuals, civil society organizations, faith-based organizations in malaria endemic countries and how they're helping to secure increased awareness as well as endemic country commitment, political leadership, resources, and maybe if you could specifically speak about what you all did in the lead up to the Global Fund replenishment last year. We've talked a lot about how NBN advocates helped to advocate for that $210 million increase for the Global Fund in advance of the replenishment. It would be great to get some insights on what was happening in endemic countries. Thanks so much.
Thank you very much, Margaret, and thank you all. I'm so honored to be here with you, and I want to thank the organizers and all of you for your support. And I want to tell you a quick story about the birth of a new movement, the beginning of a new era. So we have, last year, we have launched a new movement called Sieyes for Me, Civil Society for Malaria Elimination, because we believe that we are in a state of emergency. We believe that the malaria is a public health problem in Africa and Southeast Asia, and it has actually taken the lives of many people. Just last year, we had 400,000 people who died from malaria. And imagine what this can be as a burden of our community. So we believe that it was time for civil society organizations based in Africa, in endemic countries, to step up and to ask our leaders to take their part and to play their role in the fight against malaria. Because we can no longer accept to lose children under 5, pregnant women, and all the other communities affected by this disease. So we created the global platform that united organizations who are passionate to eliminate the disease. And our mission is first to make malaria program more effective on the ground, equitable, gender sensitive, human right based, fully funded, and increase access for all communities. Because as you know, we have the tools to treat the disease. It's a disease that is preventable and treatable, so we can no longer afford to have people dying from this disease. So we created the network to engage communities and advocates to be able to raise awareness about malaria. So we learned from the experience from you guys as advocates, from advocates in Europe, and we wanted to actually raise and have this civil society be engaged and start to ask our leaders to step up the fight. So what we did last year was a critical year with the Global Fund Replenishment, and as you know, the Global Fund is the first malaria funder, and also we acknowledge that a lot of countries depend on programs funded by the Global Fund, and the US is the #1 donor of the Global Fund. So it was very important for us that we had a fully funded fund. So what we did last year, we actually organized many advocacy events throughout Africa. We organized press conferences, we organized videos, we reach out to embassies of donor countries, and we actually also organized a series of events and meetings with our own leaders, our Minister of Health and Financing, our head of state presidency, to really ask them to step up the fight. And so we did a lot of different events, and we were able to have a seat on the table of our leaders, and as a result of that, Africa has doubled its own contribution to the Global Fund, because for us it was very important that our leaders also become donors and contribute to this global effort. So, thank you. So for the first time in the history of the Global Fund, we had an increase of contribution in countries from Africa. We actually pledged to the Global Fund as donors. But this is just the beginning. As you know, the need for malaria are still huge. The Global Fund funding is not enough. We need to increase our own domestic funding. We need to sustain our health system. We need to strengthen our health system, and we need our leaders to invest more in our health system. And we also need other partners to continue to scale up their program who are actually saving lives, such as PMI and other partners. So the advocacy doesn't end after the replenishment in October, but continues so that we make sure that we reach the fundings that are needed for malaria. Because as we are working every day, the Anopheles mosquito is also mutating, she's evolving. Like Patrick was saying, we need new tools, we need more effective tools. Those new tools are critically needed. They are costly, and they need to be deployed effectively. So we need to join our forces as global partners from Africa, from Southeast Asia, from America, from Europe, to unite our efforts to continue to increase resources. And we need to do it urgently because we don't have a lot of time. We have resistance that is coming. If that resistance was to spread in Africa, we will have one of the biggest public health problem we have seen in the history. Because imagine if you have mosquito who bites you and you don't have treatment to actually treat those people. It will be worse than the coronavirus. So we don't have much time. We need to continue to advocate quickly. We need those new tools to get to the community quickly. And we, in Africa, we are committed to hold our leaders accountable, to empower our communities, for them to continue to play the critical role that they need to play to make sure that the current tools that are working right now are being used effectively, because health is a right. We have the right to protect the children, the women, the men, everyone who's affected by malaria. So we are committed to do our part on our end to make sure that our leaders in Africa continue to go from commitment to actually actions, and those actions need to be translated into impact. And we are not going to stop until malaria cases and malaria death goes down to 0, because we believe that as human beings, we were able to go to the moon, so we are able to actually beat a disease that is preventable and that is treatable. Yes, so I just want to end by thanking you. I'm very inspired by all of you. On my way, I watched X-Men on the plane, and I was thinking that this group of people who are actually in charge of protecting human beings. And when I got into this room and I look at all of you, and I realized that you are superheroes who are actually working hard to beat a disease that you don't even have, but you are concerned by the health of others. So I really wanted to thank you and to tell you that you are a superhero and we need you to continue your work because we don't have time, and we are also committed on our part to put pressure on our leaders so that they also do their part. Thank you.
Thank you so much, Olivia. You're amazing, and I'm so excited and welcome ideas actually on how we can better connect communities here, advocates here, diaspora members here with endemic countries, civil society, and how we really can build a broader global coalition and movement towards this disease. I know we're running short on time. I do want to ask a couple questions of Rick, and then hopefully we'll have a few minutes for questions, and then I promise we'll go into trivia and lunch. Okay, so we can do this. But thank you, Olivia, and for your amazing work. To double the number of African countries, endemic countries that have committed to the Global Fund is an amazing advocacy accomplishment. So Rick, quickly, so PMI has always used data to guide programming, which obviously is a major reason for the impressive progress that we've seen over the years. So what's new and different in 2020, and what can you now do with data that PMI couldn't do when it was born 15 years ago?
Thanks for that, Margaret. I'll highlight two things. The first one is, it was mentioned earlier that we now do rapid diagnostic tests, as opposed to in the past we used to think of fever as malaria and we didn't have a test, so we considered everybody who had fever as having malaria. And we weren't right about that. There are plenty of other diseases that cause fever. So first and foremost, we're able to count cases. And that allows us to count the causes of death as well. So keeping track of that is really pretty critical. But the second one, just to pick up on the issue of insecticide resistance and drug resistance as well, one of the things that we've been able to do is we now have markers for what causes the resistance of the mosquito to the insecticide. And we've been able to test these mosquitoes in a variety of settings. And what was just described as the evolution of insecticide resistance is incredibly real. And it's real both in terms of its expansion geographically as well as its increase in localities. That is, we have the ability to test mosquitoes, and where we've tested them several years ago and now we test them most recently, we're finding the expansion locally of insecticide resistance, and we're seeing that it's spread geographically. So I raise that point because the issue is that we're not interested in providing sort of second-class tools. And so staying ahead of that, monitoring the resistance, and then being able to have our partners who are producing the next generation of nets in this situation is really, really critical.
Amazing. Well, thank you so much. And I guess that gets to the question about how you're going to stay on top of insecticide resistance and improve the delivery of care. So it's wonderful to see that we're united here and being honest about the challenges and also working together through data and partnerships and innovation, all united against the same goal of figuring out the solutions and overcoming the barriers. So could we maybe have 2 questions? Time, I know we'll eat in a little bit to lunch, but I think this is important. So Nashwan, I saw first hand up.
Thank you very much, Rick, Patrick, and Olivia, for this great session. I have a question for you, Olivia. I'm cooperating with some young men and women in Burkina Faso to run an education program in villages about how to prevent kids from contracting malaria. And the gap we were trying to fill is that most of our beneficiaries, they don't have enough information about the disease, despite the disease has been there for a long time. Or even worse, they have wrong information about the disease. And always they, when we are trying to educate them, they don't receive those information in the same way like it's coming from the health authorities, like the governmental authorities. What the tips or the advice you can give us to overcome this challenge? Thank you.
Great question. Maybe take one or two more and then we can answer them together. And I saw Sifa and the woman behind here. So, Sifa.
Thank you very much. My question is about the Democratic Republic of Congo, which is vast with many microclimates. And in addition to that, it has most inaccessible parts. So if there are any research about the relationship between the rise of malaria and the climate change?
Excellent question.
Thank you.
Here, and then one more with Stevenson, and then we have to move on.
My question's more probably to Patrick. Has your company, or is there any other companies that have thought about production in certain developing countries in Africa itself to help ease that problem of that reaching out to the last mile in the rural area? Because there is a problem with having to ship it, make it here, and then take the time, ship it there, how it gets there, going through borders and stuff like that before it reaching. So have you guys thought about production in certain African countries to help ease the delivery, mainly, to make it easier in those countries?
Excellent question. One more, and then we'll.
I try to hesitate putting coronavirus outbreak in the picture, in the discussion, but clearly it brought a lot of attention and shock to many of us. And I think it's a great opportunity also to discuss the cross-linking when it comes to treatment, and also how does the outbreak itself impact the program of Nothing But Nets, whether it's education, awareness, or the threat of funding reduction from the President's Malaria Initiative, if at all the coronavirus outbreak would need more support as a global endemic.
Excellent questions. Maybe let's start with the question about Burkina Faso and kind of overcoming education behavior change.
Yes, thank you very much. That's a great question. So besides domestic resource mobilization, we actually do advocate for more effective malaria programs. And within that, we advocate for community engagement in malaria program, because we have noticed that some of the communication campaigns, when they are designed somewhere and they are being brought to the community, sometimes the community doesn't really understand, or there's problem of communication. So we advocate for our national malaria program manager at the top to engage community at the phase of the elaboration of those communications material until the monitoring and evaluation on how community react to that. So our main sentence is nothing for us without us, because once they do start to include community at the table when they design the communication programs, then they will understand some of the issues that community face, and even the way communities want these informations to be given to them. So our main strategy, our main tactic is to make sure to include community affected by the program at the development stage of the program before it's being brought to them is key to increase understanding. But we are also engaging civil society organizations we work with to continue to empower those communities and to actually bring them together, have dialogues, and develop key messages with them, and not for them. So it's a strategy that we use, and we really believe that community engagement is key to empower them and to make sure that they can also use the behavior, take the behavior that we want them to take.
Yes, thank you very much. That's absolutely a fantastic question. For many years, we hesitated simply because of the economies of scale. So because we produce in Vietnam and have been doing so for the last 20, 25 years, and because of the bulk buying price pressure on mosquito nets to have them supplied and delivered at the cheapest possible cost, we maintained a strategy of scaling up our production in Southeast Asia. But to your point, having them manufactured in Africa obviously reduces greatly the cost of distribution, not least given the fact that today the cost of distribution is actually much, much greater than the actual price of a mosquito net. So to answer your question, yes, I'm actually in the final stages of establishing a production facility in Nigeria, Thank you very much. I would like to say, I didn't place the question at all, but it's very important. We focused on Nigeria. It's the most populous nation. It's the nation with the highest burden of disease. So first and foremost, if we want to reduce malaria in Africa, let's look at reducing it in one of the most populous countries in Nigeria. But it also allows us to expand beyond the borders of Nigeria. So just south is DRC, which would be the second most populous country in Africa. So thank you for your question. It is very important that we have a foot into Africa and that we understand Africa and that we produce for Africa. So thank you.
Thank you. And without revealing too much, Patrick is also and his team are working on some really exciting innovations in terms of, someone asked a question about the waste of bed nets. And so without getting into it, there's also a lot of innovation, and we're trying to explore investments to help address that issue of waste of bed nets and how can you actually use recycling materials to create and break down, et cetera. So maybe if you're interested, talk to Patrick about that afterwards. So there was two more questions, one on coronavirus and sort of implications, as well as malaria and climate change intersections in DRC. So who would like to take those? Rick?
Sure, I'll take them quickly. So climate change is, let me just leave it at one word, it's complicated. That said, weather drives what happens in terms of transmission, because weather determines when it rains, when there are places for mosquitoes to breed, when they, in large numbers, can move around and transmit. And so we do need to pay attention to weather. I would argue, though, that weather actually is really important to think about how our supply chain works so that we have what we need in the places we need it before it becomes unable to be reached because of the rainy season, et cetera. So we should probably be thinking first and foremost about weather. The climate change that we're experiencing on this globe is such that we don't need malaria to be the driving force behind that. There are plenty of other reasons to pay attention to climate change. In terms of COVID-19, let me just say that, one, it is important for all of us to recognize that this is a tremendous concern. Concern not just, concern, you've seen it in the financial markets way beyond what we've ever seen before. That's an indication that a disease like this, new though it may be, can really wreak havoc. And it's not the only one that wreaks havoc. As a matter of fact, malaria that you're interested in has been doing so for generations, many generations. And so we should take stock of that. And I will point out that, in the Ebola crisis in West Africa, there were far more deaths from malaria than there were from Ebola. And so yes, it's important that our leaders around the globe are paying attention on the public health front and on a new disease. But that's an important message to take up on the Hill, is that this is maybe not new, but it is huge.
That's right, and that's a perfect way to end. I think we've reminded people that's why we did proceed with this conference. A child dies every 2 minutes. Congress needs to hear from us. So thank you again all for being here, and thank you panelists for joining this really rich conversation. We will have lunch, so maybe you can find them afterwards if you have any additional questions. We are gonna do a quick, let's clap. Thank you, thank you.